Mula, Fiji. After another 2,217 tests yesterday, we had another daily record of testing, and we have confirmed around 12 new cases of COVID-19 since our last briefing. All these cases are from Makoi and are close contacts of case 140, the woman who presented to the Makoi Health Center yesterday with COVID symptoms. 4 of the positive patients are her own household members. 7 are from an adjoining home, and 1 is a secondary contact. All of them have gone into isolation. As mentioned yesterday, case 140 presented to Makoi Health Center and was immediately treated as a suspected case by the medical staff, who then provided care in full personal protective equipment. And once she tested positive, that same day we quickly were able to identify the people with whom that person had come in close contact with. So we were able to take immediate measures to help stop the spread. That shows that our reporting, screening, testing, and contact tracing procedures are working as they were intended. However, we know that since a large number of these persons' close contacts have now tested positive, that means that there has been a significant amount of movement and potential for transmission of the virus to others. Case 140's travel history and the travel history of one of her contacts has required that we close 3 grocery shops in Suva for decontamination. We're also testing the employees. Those stores are not being closed indefinitely. They will reopen as soon as our decontamination procedure is completed. The contact between this individual and the members of an adjoining household is troubling, and it should serve as a learning opportunity for all of us. Our bubbles must be limited to our households, to the people who share the 4 walls of our home, not our neighbors, not our friends, not even our family from across the road. We should only interact with the members of our household and no one else. Call your friends, call your family, call your neighbors, but do not see them, nor should you visit them. Please do not party your way into an isolation facility. If you are outside, it must be for an essential reason. If you interact with others who are not members of your household, it should happen 2 meters apart, and both of you should be wearing masks properly. Let's remember this cluster began with another case of unknown origin. So that means there could still be a contagious case or cases among the public we have yet to identify that will still pose a threat to all of us every time we make a decision to leave our home. Home is where you are safest. If you leave home, wear a mask, make sure you have Care Fiji installed and with a Bluetooth switched on. Now, based on the rising or the worrying rise of clusters and cases, I have been working with my fellow permanent secretaries as well as private sector on scenario planning based on the results of our continuous testing. And that includes the possibility of a full lockdown of Viti. Now, I want you to hear me very carefully because I think there is a lot of stupidity that's happening out there in the community with regards to panic buying. In the event, our priority is locking down the virus in an active fashion, as I've said yesterday. For that lockdown to be decisive, it must be well planned and prolonged enough to last for the entire incubation period and more. The goal of the lockdown is to stop all unnecessary movement and mixing between different people, informal gatherings, and other high-risk activities that will carry significant penalties. Essential movement will have to be highly controlled. Businesses and private sector must take on a much higher level of responsibility if they expect to operate at all. And I want to assure the public that if we take the lockdown route, they will be given ample notice, not hours, but days to prepare, and for government to allocate resources appropriately. May I repeat that? You will be given days to prepare, for you to prepare and for government to allocate resources appropriately. I hope I make that very clear. I also want to make sure that everybody is clear that I was not responsible for the panic buying that happened today. That was not from me. When I can, I'd like to end this announcement with some good news. News that shine a light on everyday heroes, and that shows the strength of the Fijian spirit despite the challenge that we face today. The MV Vevueti, our medical carrier vessel, was dispatched to Lautoka to offer healthcare services soon after we transformed Lautoka Hospital into a well-contained COVID care facility. Today, on board the vessel, a surgical team performed the first cesarean section operation. They delivered a healthy baby boy to a proud mom, just one day after Mother's Day. As part of our delivery team was a midwife who came out of retirement to serve the nation in our hour of need. She came forward because she knew her talents would be put to use. She came forward because she's a proud Fijian, ready to give more of her time and effort on top of the lifetime that she's already spent caring for her fellow Fijians. That is the spirit that will guide us through this crisis, a spirit of selfless solidarity. We can't all deploy on medical vessels to perform life-saving emergency surgeries, but we can all take simple steps, like the good hand washing, like maintaining physical distancing, like avoiding gatherings, like installing Care Fiji app. All these protect the most vulnerable Fijians and pave a way for better days for the nation. Let's take them together. Let's do it together. We can, we have, and we will do it again. Thank you.
Mr. Bolonaka, in addition to what we've heard from the PS, in terms of the FIMET field hospital, so as you can see or hear from the report, the field hospital is working well and serving the people of Lautoka. In the last 24 hours, 31 patients were seen. 8 patients are currently admitted at the hospital. 3 patients had surgery in the field hospital, and as you heard, today we also had the first cesarean section done by the FIMET obstetrics team at the MV Vevueti hospital ship. In addition, the antenatal clinic services have been reviewed by the team, and they've decided to that VCCA Health Center is a bit far from the main center of town. They've decided to utilize the vacant medical services specific office at the corner of Ndrasa Avenue and Awini Street in the middle of Lautoka for this purpose. So from tomorrow, Wednesday 12th May at 8 a.m., the antenatal services and antenatal clinic services for pregnant mothers will be held from this new site in the middle of town. And for you, the people of Lautoka, you know this place very well. It's opposite the old police headquarters in Lautoka. Services will start from 8 a.m. and there'll be a special focus on high-risk mothers to be seen in this facility. Our screening services picked up pace from yesterday and was full on today. The 57 screening clinics were fully operational, and in the last 24 hours, 3,731 individuals were screened, of which 382 had a swab test for COVID-19. For the mobile community screening, this continued in the Western and the Central Division, and in the last 24 hours, a total of 23,723 individuals were screened and 485 were swabbed, giving a total of 343,609 individuals screened to date and 9,707 swabbed. 4 community isolation facilities are in use, and we have a total of 70 individuals in the four facilities looked after by the combined health and the military team. To conclude, reiterating our message, a COVID-safe message for everyone, be watchful of your bubble and guard your bubble. Stay at home, wear a mask, wash your hands regularly, practice the correct way to cough and sneeze, and download the Care Fiji app and activate the Care Fiji app by switching on the Bluetooth in your phones. Vinaka Wakalevu, and good evening.